back to school 1.0, and then tomorrow we've got more schools starting up with the face-to-face. Man, Doc, I don't know about you, but it kind of happened so fast. Back to school already.
I think it's been a long time coming. A lot of my students or my patients are really excited about going back to school and seeing their friends.
Yeah, that's crazy because we just had Jess Garcia from DPW on, and he was giving us some of the numbers for busing. And it was like one school had 3 students ride the bus, and they had dedicated 5 buses for the busing. So I'm not even sure if that's anecdotal or if that's a real representation of how many kids are going back to face to face. But you're right, that is like the number one thing you hear is kids, I miss my friends, or parents like, oh, they miss the interaction.
Yeah, it's definitely going to be good for their mental health for sure going back. There's actually an article in the Journal of Pediatrics that was recently published online before the print. And they did this study where they looked in North Carolina. I think it was Wilmington, I believe. And they looked at the school district and they followed the school for about 9 weeks to see what it was like. And of course, you guys know, the states were much higher rate of COVID than we do. I think at the time they did it, though, it wasn't as bad as it is now, of course. And they found that over 9 weeks, there was a really, really, really low incidence of spread within the schools, which is, really, encouraging for us. I did find that a couple findings in the study were pretty interesting, and this is going to be something important for everybody to keep in mind that's going to be at school, is that as the weeks kind of went on and they kept doing really well, they found that it was actually the adults at school, the staff basically, that were starting to get a little more complacent forgetting their masks. And so one of the study findings was to kind of encourage and remind the adults that, hey, you guys are really important in protecting this. Whereas the kids were actually really good about it. Although they did find that the small incidence of spread that they did have in schools, the special ed population, with those kids, sometimes it can be a little bit harder to just keep the mask on.
Right.
And that's just going to be a different population with different challenges. Right. And so they found that, hygiene and ventilation was going to be just really a little bit more important with those populations. But for the vast majority of the kids, they did just really well. They followed the rules and things seem to go pretty smoothly for them in North Carolina. So hopefully we can see those results are even better out here.
Right. Let's talk a little bit more about that study here. And you talk about students with special needs. I know that there are a bunch of students with special needs going back. So according to what you know, what are the best mitigation measures to have in place for that student population?
It's still going to be the same in terms of some sort of face covering. So with the special need kids, I think in this study, they were saying like the ones that couldn't wear a face mask, they tried to do a face shield, but sometimes they couldn't do that. And so in that case, the people around them have to wear a mask. Good ventilation. I think that's one thing that's changed from the beginning of the pandemic. Initially we were saying, oh, it's all respiratory, no, nothing airborne. But now, of course, we know that there are some airborne particles that stick around. So good ventilation and good hand hygiene, frequent hand hygiene, I'm sure.
Doc, what are you hearing about the variant? I know you're a well-read guy. Every time we have you on, you're talking about reading this journal, reading that. So what are you reading about the variant, the mutated strain of COVID-19?
The big one so far, everybody's heard of the UK variant, I'm sure. There's a South African variant and there's a Brazil variant. I think there might be one more that I'm missing. Some of them have shown that the spike protein, which is currently our 2 vaccines, they're replicating the spike protein in our bodies, and then that's what we're making our antibodies to. And so there is a concern that our vaccine might not be as protective against it, although there's optimism that we would be able to just kind of tweak the vaccine. And since we're this far, a lot of the vaccines are much more developed now. It would hopefully be something along the lines of changing the flu vaccine every year. So much quicker, and it won't take 18 months of all out efforts every year. But we don't know yet, right? We don't know yet for that. The other thing though, that seems to be true, definitely with the UK and the South African variant, is that it's much more transmissible. And so, the mortality rate hasn't changed, but if you're just getting a wider, swath of the population getting it, even if it's just not even if, but still the 1% mortality rate, we so far, how many people in the world has gotten COVID so far? 7 million more.
Yeah.
and then you just kind of multiply that, the numbers are just going to be staggering. So in the UK, I think they're hearing that younger people are showing up, but I think they're all just kind of anecdotal yet. Again, we just don't have the data for it as of yet, but stuff will start trickling in, and then we'll see. So it's really going to be important for the young, healthy population to really not get complacent and do all the things that we know we're supposed to do. Thankfully, I'm so grateful to Guam. We had our kind of scary points earlier or later in the year last year, but I mean, look at us now. We are miles ahead of the States.
Doc, going back to talking about this variant, the conversation, the news reports that we're seeing on the mutated strain of COVID-19, it really reminds me of when we first started hearing about COVID-19, right? It was kind of like popping up here and there. And so I want to know, like, in your opinion, how serious are you taking this variant? And is it a case of where we're hearing about it now and then, 6 months down the road, it's going to be widespread wildfire, mutated COVID everywhere?
It's possible. I mean, we already know that the UK variant was found in Korea and I believe Japan as well. So, we still have travelers that go back and forth. It's only going to be a matter of time before it gets here. I got both of the doses of my shots, but I still wear a mask everywhere I go. I wash my hands frequently. One thing with the vaccine, we don't know for sure yet if it's going to be preventing transmission. We hope it will, but we're not sure. So, I'm not really, taking anything for granted and still doing the things we need to do. Great news is with these variants, the protection measures are the same, and we've had just about a year to practice them now, and I think we've gone pretty good about it. It's just, as things start opening up, and I'm happy as everyone else that restaurants are, up to like 50%, and we're able to get out and about. We just can't get sloppy.
Yeah, and I think that's the key point is so many of us are just so pent up from not going anywhere, not being able to see people, even not wearing a mask, right? I feel like it's not necessarily going to be sloppy, but we're just going to be a little eager, right? Whereas, someone who may have been being extra careful a month ago now takes a look at what's open, what's not, where people can go, how many people can go to these places, and thinks, oh, well, we're vaccinating people. It's kind of over, but it's not.
Yeah, it's really not. I was really skeptical. I mean, I'm so glad 2020 is over, but I think we might need another year, and before we can hopefully be in the clear. 2021 will be kind of like round two, it looks like, but hopefully not.
That's what I said. I said 2021 is 2020 2.0.
Yeah.
Doc, I wanted to go back to the vaccinations, right? And so everybody knows, or they should know by now, that kids can't get it, right? Anyone, what is it, under 16?
I think under 16, I think, yeah, I think that's about right. Pfizer study, I think, was 16 to 18-year-olds. And really the reason we're not recommending it for children yet is that the studies just haven't been there. And so, they're working on it, they're doing it. It's most likely going to be fine. It's an mRNA vaccine. There are already, some reports that, there haven't been any like breastfeeding or pregnant women studies, but of course, inevitably, some people have gone in without knowing that they were pregnant at the time and then got maybe the second dose knowing that they were pregnant. And we expect that everything's going to be fine. But I've had parents come in and say, you know what, Doug, I just haven't seen, I know there aren't studies, and I'd just like to be on the safe side. And for that, that's a completely reasonable stance to take. Right. But with the other shots that pregnant women get, they aren't as the mRNA is a very, I guess, body-friendly way of creating antibodies, I would like to think. And so, people get the rubella shot and the DTaP shot. So I think it should be okay. I think the research and the data will eventually show that's going to be okay. And we're going to find out that's going to be the same way for kids too. Thankfully, COVID is not, as of yet, a major pediatric issue. Right. And so, the rush to get it out to the kids is, just not as severe as it is, or as urgent as it is for the elderly population.
Let me ask you, Doc, why isn't it a major pediatric event?
Meaning, why aren't the
Why?
kids getting as sick as
Why
the
don't
older?
kids get it as
Oh
much
yeah.
as the
So
adults? And
I haven't read anything since, I don't know if you remember, way back in March we were talking about this, a little bit before I got COVID, and it was the ACE2 receptor, and I think we're still using that as if I'm incorrect, I'm sure somebody will chime in, but the ACE2 receptor, kids don't have it at a very young age, and then as we get older, we get more of it, and these are
mm,
the receptors that are kind of in our lungs and those, etc. And so, they just don't really have as much, I guess, even if they're exposed, it doesn't get into their system as much. And that's kind of the hypothesis we're working on at the moment. Probably there were many more cases of kids having it, but maybe so mild earlier in the pandemic that, they just didn't check. I've definitely had families come in where entire family's sick, kids are running around looking great. And then it's the parents who are just looking really tired with the aches and chills, saying like, "Oh yeah, but we're really feeling it."
yeah,
Um, and in any rate, I'm super grateful that it's not the kids. This would be
totally.
just a complete nightmare,
Yeah,
even worse than it is.
right.
Yeah.
And then with the vaccination, we every time someone comes on about vaccinations, we always get in the comments like, "What about my 12-year-old?" or "What about this?" And so, just kind
Mhm.
of to reiterate, um, because people kind of look at that, they say, "Oh, see, the kids can't take it. Oh, yep, you're going to grow a third eye."
Yeah.
Well, why is it that we
So,
don't get it to
we're just
kids?
trying to be really safe. All the organizations around the world are very hyper aware that people are understandably a little, nervous. It's a new vaccine, right? And so they're not going to say, "Hey, we think it's safe," judging everything else. So let's just rush it out to everyone. They want to, you know, do their due diligence and show that it's going to be okay. And that's why. But I really expect that it's going to be a very safe vaccine for kids when all the data rolls out.
Right. And then with the physicians advisory group, I know that you guys have still been meeting, but meetings
Yeah.
are they getting shorter and shorter? I mean, is there still a need for this PAG,
Um,
and what are the discussions like?
the Yeah, so yeah, the meetings have thankfully gotten a little shorter the past few times. The governor specifically asked that we continue to meet on a weekly basis, so we're honoring that. But right now, the kind of focus shifted into really the three clinics, the three bigger clinics, and probably a lot of the other internal medicine and adult clinics in helping with the vaccine rollout. And I think they actually have like a separate group that discusses that. You know, now that things are opening up, there's some talks about maybe taking another look at the quarantine guidelines. One thing, that was kind of in the discussion was was actually making it not so easy for even essential workers. So if I went off island and came back, it's like, okay, you can go to work, I suppose, but maybe we should be quarantining ourselves as well. We don't want to have a repeat of what we did before, where we kind of opened up a little too quickly.
Right.
And then, the school discussions, the schools that really kind of, we gave our input really early, and now that that's going really well, I haven't really heard too much about that. So, but, I'm sure if there's any issues, medical issues that come up, they'll reach out to us. Oh, one thing I did want to bring up to all the parents out there with their kids going back to school, there are other viruses besides COVID.
No
And I
way. Get
have
out of
not
here.
seen, and I have
What?
not seen a whole ton of kids get super sick, because everybody's been staying home. But kids have still been showing up with, some sniffles and cough. And of course, the schools are going to want you to get checked out. If everybody else around your household and have been any adults that have been really ill at school, your mind will naturally jump to COVID. But in those cases that we've checked so far, and we've checked all of them, it hasn't been COVID. So, as they get back to school, they're going to be playing and sharing some germs. There are definitely, at least with COVID, we're not seeing kid-to-kid transmission as go as easily as other viruses. So if a bunch of kids get it, maybe not COVID, but of course they can get checked out and make sure it's not. But yeah, they'll still have to take the usual precautions, but just keep that in the back of mind for all the parents that are sending the kids back. They'll probably pick up a little something.
You said you talked about opening too fast, and I wanted to ask just your opinion, because I remember when we When the car score was concocted and we got it down to a point where it pleased the governor so much that we were rewarded, right, with the easing of restrictions. And I remember at the time that they announced the first easing, which I think was an increase in the gathering limitation from 5 to 10, I want to say. Well, when they came out with that announcement, I remember the governor had said we're going to be looking at decisions that are going to be data driven. And here we are a month later, and we went from 25 to 50%. We have dine-in now. It just kind of all kinds of things are open. In your opinion, was that a reasonable timeline for reopening? Did we rush things maybe a little?
Yeah, I think that what we are looking at was that kind of big spike we had back in August, right after we kind of opened up, after we did well in July, and it was really, and I know like I'd love the bars to be open again, but it's really in a bar kind of atmosphere, right, when people are really mingling and talking and getting really close and not wearing masks, and that was part of it. I know some of the gyms, and so all the mitigation places are taking effect. I think if there is a pathway to opening up more things, but we'll just have to go a little bit more slowly. We had that scary experience of the hospitals being completely overwhelmed. If you go to the restaurants now, you see that people are really good about staying at their own table,
right,
and generally wearing masks and everything. So we just eventually, of course, we want everything to be opened up, but I think the rate that we're going out with right now is pretty good, and we'll see how this goes. And especially with this new variant around, it's not. I think we're not too much. So yes, I think it's appropriate.
I know a lot of people were kind of waiting for that after Christmas spike in positive cases. We just haven't seen it though, right? I mean, we saw.
Yeah.
I mean, our test positivity is so low that when I see like a 17 or a 21 or a 15, I'm like, oh my god, right? Which is a far cry from when it was like 100.
I know. It's such a credit to, and just a reflection on how well Guam is doing, and how the people of Guam have taken this seriously. So, really, the credit goes out to everybody that's been taking this seriously and wearing their mask and washing their hands and staying. Really, the big thing is like staying away when you're sick. As far as not going to meet up with friends or going out to a restaurant if you're not feeling well or have a little cough. Staying home is, just going to stop the spread. So yeah, we did a great job. We were anxiously watching from the PAG, just anxiously watching the couple weeks after Christmas, but we did well. So let's continue this.
Yeah, just with the holidays, it was like, let's wait a couple weeks after Thanksgiving, and then thank God nothing really happened. Then it was like, oh, let's wait after Christmas, and then it was, oh, let's wait after New Year's, right? And so here we are, we're right in that window of after New Year's, and you're right. Thankfully, people out there must be taking it serious, or either that or the tests are malfunction. I don't know. Go ahead, Jason.
No, I think the tests are still good.
Yeah. Okay.
Well, there is one thing that I remember Dr. specifically was saying. He was the one physician more than any other that we've talked to where he was saying very early on, Chris, is, please everybody also get your flu shot, right, because flu season's coming up in what would be considered like the winter months here and everything like that. And we don't want that on top of what we already have to worry about. And then Doc, I know a colleague of yours on the Physicians Advisory Group, Dr. Ann Pobutsky, was saying that we're actually seeing, I don't want to say record low numbers for the flu, but like surprisingly low numbers because people are staying inside wearing the masks and washing our hands.
Yeah. Happy coincidence.
Worldwide, I think it's been a historically low flu season because, guess what? All the things that we do to protect ourselves from COVID, protect ourselves from other viruses. I have been hearing that at GMH, we still get people that do test positive for flu. So it's not like it's not on the island.
Right.
But it's been very, very low, and I'm so thankful for that.
And that is the one thing that I remember about Dr. because Dr. was the one doctor that was really pushing, make sure everybody please get your flu shot for you and your children. And then it was Dr. Felix Cabrera who was saying, and everybody please watch your weight. Every physician had their own, kind of like thing that they were promoting and everything. But yeah, Felix was like, go out in the yard, do some sit-ups, take a walk around the house and everything, but you really got to watch your weight.
Yeah, and while the COVID numbers have been down at the Guam Memorial Hospital, what hasn't been down are the non-COVID admissions, right? So, Doc, just from what you're seeing, are we getting sick people who kind of put off whatever they needed to do during the pandemic?
I think so. A lot of these, my guess is that there are some people with chronic conditions that, understandably didn't want to go into the clinics because they're saying, oh, well, there might be COVID people at the clinic. Reasonable assumption. And the general healthcare maintenance stuff, especially with these chronic conditions, kind of got out of hand, I suppose. And so now we're seeing basically more acute presentations of what could have been a more minor exacerbation or illness. And yeah, you're exactly right. As our COVID numbers have gone down, the hospital census is being propped up essentially by all these non-COVID patients. And so I think in the ICU, I didn't see this morning's numbers, but in the ICU, I think there's more non-COVID than COVID.
Right.
So
then it also seems like with the COVID patients, I mean, it's very low numbers, but we're seeing high number of deaths. Like when you look at how many people are in the hospital versus how many deaths. Right. So I don't know if that means, I mean, Lillian's off island. We'll probably get someone from GMH on this week, but I don't know if that means that the people who are getting COVID are getting it really bad. Do you know?
Yeah, I don't know. Your guess is as good as mine with that one, but yeah.
All right, Doc. Anything in closing? How was your trip?
My trip? That was a while ago. It was great. It was felt really good to just kind of escape for a little bit. Mentally more than anything.
Where'd you go, if you don't mind?
Went to Hawaii.
Wow.
Nice.
Visit a friend. Yeah, so we visited some friends out there, and I got back just in time. I think right when we got back, they were saying that their cases were increasing, and it was due in part because they opened up the travelers, right? If you had a negative test, you wouldn't have to be quarantined.
Right.
We were negative, and we stayed negative out there. They gave us actually a free test as part of a study. And when we came back, I saw that, they saw that some of the tourists were actually bringing it in. So
wow.
I'm glad I wasn't part of the problem, but realizing that, it's not going to be as easy as just a pre-visit test to start traveling. But hopefully the vaccine changes things. But I think it's going to be a while before countries and states start shifting toward vaccine to exempt people from quarantine.
So what's Hawaii like when you go around? Do people wear masks, or what kind of restrictions?
Yeah, people were wearing masks. When we're just walking around, they would have security. I don't think there were actual police, but maybe security just kind of stationed every 200 yards or so, and just kind of like making sure people were wearing masks. People were really good about it, going to the restaurants. Very similar to how we were doing it. They have, I think they were down to, 50% occupancy at their restaurants. Bars were all closed. And they were taking it really, really seriously.
Wow. Yeah. Did you run into any of those Karens, or what do they call them?
No, thankfully. I think it was, I'm so grateful that's not us. That's not Hawaii. I'm sure there's people who want to. We
had one here, Doc, while you were gone. You might have been gone, but they had one at Payless where a lady would try to come in with she was trying to pay with no mask. Really? Yeah, it's crazy.
Oh, geez. But yeah, I guess the fact that, you can say that there was just one.
Yeah.
I guess
on. That's good news.
That's a good sign.
Thanks, Doc, for your time. I appreciate it. It's been a long time. Good catching up with you, and always appreciate your insight.
Hey, thanks for having me on, Chris.
Okay, Doc.
And Jason.
We'll see you.
Have a good one, man.
That's Dr. Michael He's the with the Education Committee on the Physicians Advisory Group. Always good to have him on. It's 9:09. We're going to take a quick break, and then we have a sponsored segment with Andy Wheeler, Jay.
Yep. Yeah, here's to your health. And he has got a new guest on the show, Dr.